Us from the organizing committee of this meeting. First, I'd like to introduce the organizing secretary, Professor Felix Jabasing, Professor of Endocrinology, Deputy Medical Superintendent in the department. I'm Nihala Thomas. I'm Senior Professor of Endocrinology and the organizing chairman for this meeting. This is the meeting, the VELLOR Endocrinology International Congress, which is going to be held on the 10th and 11th of January, Friday and Saturday. It's a meeting which is a consortium. 3 institutions are joining together: CMC VELLOR, Department of Endocrinology, the Albert Einstein Medical College in New York, who is a close collaborator, been doing research with us for the last 10 to 15 years, and Arunda, which is a consortium of institutions headed by the Tata Institute of Fundamental Research in Hyderabad. So the 3 institutions are joining together to organize this meeting. This meeting is also recognized by the Endocrine Society of India, and for educational purposes is endorsed by the Tamil Nadu MGR Medical University and the Tamil Nadu Medical Council. Right. So this is a fairly large meeting. We have totally 30 international faculty and around 60 Indian faculty as well, from across India and across the world and from different parts, Europe, Africa, America, who are being involved with this meeting. So that's both of us. And so the theme of this is diabetes. We know that the commonest form of diabetes is type 2 diabetes, where people put on weight, get a slightly big belly, and in India you don't have to be very fat to get type 2 diabetes. Yeah. So, but there are other causes for diabetes besides type 2 diabetes. You all know type 2 diabetes is very common. Most of the people you see, 85 to 90% have type 2 diabetes. But there are other types of diabetes where people are not obese, they are thin, lean people who have diabetes. So there are many other causes for this. To have type 2 diabetes, usually the BMI, kg per meter squared, is more than 23. In these forms of diabetes, people are lean. They have BMI less than 20 kg per meter squared. So what is the commonest cause for lean diabetes? People being very thin and having diabetes. That is type 1 diabetes. That is the commonest cause for people who are thin, who have diabetes. Type 1 diabetes as the important cause for people who are thin. But there are other causes, and this conference is trying to discuss the other causes for thin diabetes other than type 1 diabetes, which people are not recognizing commonly. There is one cause where the pancreas may have stones inside it. Severe pain because of stones in the pancreas. They took off part of the pancreas and you can see the stones inside there. In the condition is called fibrocalcific pancreatic diabetes.
Fibrocalcific pancreatic diabetes என்று சொல்லி இதற்கு ஒரு பெயரை வைத்திருக்கிறார்கள். இது ஒரு நீரிழிவு நோய்க்கான ஒரு முக்கிய காரணமாக காணப்படுகிறது.
It is found in multiple parts of India. It is also found in Africa and in the tropical areas. It is not found in temperate areas. It's only found in the tropical zones.
அதிகமாக
Bangladesh, Indonesia, Tanzania, Kenya, West Indies, it is found.
இந்த குறிப்பிட்ட
Cause for thin diabetes sometimes is inherited genetic forms, passed on to 50% of the children. May not mean all inherited causes. A small proportion of people who are thin who have inherited disease. One more cause, which is not very common in Tamil Nadu, but more common in other parts of the country which have a lower GDP, a lower income. States which have a lower GDP. Tamil Nadu, as you know, is a state which has a higher GDP. This is called malnutrition modulated diabetes. So That's an example, but we do see it in Tamil Nadu, but it's not very common. It may be related partly to people being born low birth weight and after that have malnutrition, are not eating well after delivery. People who live with HIV can also, after having treatment for the virus, can have a greater chance of developing diabetes. Have abnormal distribution of, they may be thin, but they have abnormal distribution of fat in some parts of the body. So that is one, it's called HIV lipodystrophy. There is also an inherited kind of thin people who have abnormal distributions of fat called lipodystrophy. Okay, so that's just a picture of a person who has stones in the pancreas. You can see, and the pancreas is shrunken. Patients with fibrocalcic pancreatic diabetes, not only do they have diabetes, because the pancreas produces enzymes which help in fat absorption. So they lose fat in the stool. Okay, so this conference is 2 days. There are more than 70 talks, and I'm going to highlight some of the talks which are going to be given. There are going to be some orations by famous scientists. There are many famous scientists. We could give orations for only 6. I'm going to highlight that. Many of you may know Professor A.S. Kanagasambapati, who passed away recently. He was one of the pioneers for biochemistry in CMC VELLOR and also for biochemistry in India. So to acknowledge his contributions, we have Dr. V. Mohan, who is an eminent diabetologist in India. I'm certain you might know him. So he will be talking about early gestational diabetes, that is diabetes in pregnancy and how it might impact diabetes later on in life. Young ladies who have diabetes in pregnancy may develop type 2 diabetes much earlier in India. All of you know Dr. Albert Einstein. Albert Einstein is of course a very famous physicist, scientist, but indirectly his discoveries in physics have actually helped in several other aspects of medical science. There are 3 patron institutions for this meeting: CMC VELLOR, Albert Einstein Medical College, New York, and that is why we have constituted this oration. Professor Alan Waugh is an eminent scientist from Denmark, Copenhagen in Denmark. He has shown through very intricate basic science research studies that people who are born low birth weight have a propensity to store fat and develop type 2 diabetes later on in life. So, this is important because 18% of people in India are born low birth weight. Oskar Minowski is the man who, before, many years ago, about more than 130 years ago, discovered that the pancreas, something in the pancreas is responsible for diabetes when he took off pancreas from dogs. So what? In his name, Dr. Kaushik Ramaya, who is a professor of diabetology in Tanzania. He's not from India. His probably ancestors must have gone there before 1900. He is a Tanzanian who is going to be talking about different types of diabetes in Africa. Important because diabetes in different parts of the world there are similarities, but there are also big differences. Homi Bhabha, as you know, is the father of the nuclear program in India for peaceful purposes and eventually for medicine, because you know that nuclear isotopes are used for treating various cancers. Founded the Tata Institute of Fundamental Research in India. Professor Meredith Hawkins, who is personally a very close collaborator with our department for the last 15 years on thin people with diabetes, on malnutrition and diabetes, is going to give the oration. Our group, that is CMC VELLOR, along with the Albert Einstein, have found the physiological relationship between malnutrition and diabetes. Rosalind Yallo is the second woman in the world to get a Nobel Prize in medicine. For women to ever get a Nobel Prize. She basically invented tests to detect measurements of insulin in blood. Professor Chittaranjan Yajnik is a very eminent diabetologist who has done a lot of work over the last 35 years on how low birth weight babies growing up can develop gestational diabetes and subsequently type 2 diabetes. So he's looked at it, and he's looked at it in multiple generations. Is the mother of nursing in VELLOR, in CMC.
வேலூரிலே செவிலியர் துறை ஆரம்பித்தவர்கள் யார் என்று கேட்டால் டெலியா நியூட்டன் என்கிற சொல்லப்படுகிற இந்த அம்மையார் தான்.
So you know that CMC VELLOR gives a lot of importance towards nursing care and nursing education, and she is the pioneer of nursing education in CMC VELLOR and for India. Professor Nikhil Tandon is the head of the Department of Endocrinology in All India Institute of Medical Science in New Delhi. I told you that Mohan is talking about early gestation diabetes. He's talking about after delivery, after having gestation diabetes, what happens long term. So I'd like to highlight the others. These are not orations, but these are very eminent people. Professor Peter Schwartz is coming here. He's the president of the International Diabetes Federation. He's from Germany. Mukesh Appakalai has done his PhD in CMC VELLOR. Today he is settled in the United States, and he's the #1 islet cell transplant person in the world. He's done more than 4,000 islet cell transplants. That's the cells inside the pancreas. You take them, put them into the liver, and they can treat some kinds of diabetes. Understanding the pancreas and the islet cells which produce insulin, this is Alvin Powers from the United States of America who will be talking about this. Professor Azad Khan is one of the founders of diabetes care in Bangladesh, and he'll be talking about diabetes care in Bangladesh. Jaka Obodo is from the Ivory Coast in Africa. He's the director of the International Diabetes Federation for the Africa sector. Talking about a kind of diabetes which is much more common in black Africans. Dr. David Phillips is from the United Kingdom, England, and he is talking about, he's done research in Africa, and he's talking about lean people, thin people with diabetes in Africa. Davis Kiberge is from Uganda. He's also covering some aspects. Dr. Debbie is from West Indies, and she's been talking about how malnutrition in children can cause diabetes. Dr. Dirk Christensen is from Denmark. He's talking about how malaria in pregnancy can cause diabetes in adults. Dr. Faria is the president of the Endocrine Society in Dhaka, and she's also giving a talk. Dr. Srikumaran Nair is from the Mayo Clinic, a very famous clinic. He's been 30 years over there in USA, and he'll be talking about how certain aspects of insulin resistance can cause dementia, Alzheimer's disease. Dr. Michael Bowen is also from West Indies. He's from Sri Lanka. And Dr. Robin Maskey from Nepal. Sarah is from Scotland in UK. One epidemiologist in diabetes. Diabetes is on Friday, that is on 10th of January at 6:30 p.m. in the Scudder Auditorium in Bagayam. People whom I have shown you will be there, and beyond that, of course, the chief guest for the program will be Dr. Narayanaswamy who's the Vice Chancellor of the MGR University. He'll be there. And the other dignitaries, there's a list which I've given you that will show you the list of others.